The number one skill that I would recommend that every physical therapy student truly master is how to coach exercise. Here's the thing. You're in a profession that once you graduate, you are then recognized as a movement expert. The thing is, in my opinion, a true movement expert needs to be an expert in coaching movement. The problem is that there are two main reasons as to why it's really hard to achieve that just by going through your school's program. And so in this video, I want to talk about the two main things that prevent that and how we can start to remove those barriers so that you can accelerate your coaching knowledge and not wait until you're years into the profession, but become an expert while you're in school. So the first problem that prevents us from really mastering our ability to coach movement are the goals of your school's program. Every single physical therapy school has two primary goals: to get you to pass your boards and to produce a generalist physical therapist. Now, I'm not knocking schools at any way, shape, or form. They do an amazing job at reaching their two goals, and it's what's required to move along in the profession. The thing is, to produce a generalist physical therapist is not going to provide you the material that's needed to coach movement at an expert level. And so there's a big disconnect here, and it often leaves that big gap in that imposter syndrome as we start to go through and reach graduation, and then we're really not confident with our ability to coach movement. The second thing is that prescription is different than coaching. I know all physical therapy programs have exercise prescription courses. And yes, you will go into a very small amount of detail as to how to coach movement. But prescribing exercise is more generalized. It's when you have a low back pain patient and then you follow a protocol. And it's just looking at their condition and not the actual patient. Conversely, coaching is more intentional and specific. And so that understands and recognizes the patient and their dysfunction, not just the condition they have. And it goes into how do we cue it so they understand what to do? How do we frame it? How do we educate them? How do we set them up so they're in a position of success compared to doing the typical 3 sets of 10. And so with these two problems, the goal of the physical therapy school and the surface level exercise prescription class, it makes it really hard to truly feel confident and own the ability to coach movement. So then the big question is, what do we do to fix this? What actions can be taken now? Well, the biggest thing that we need to be aware of is that you do have time. It may not feel like you have time. I know as a physical therapy student, you have long days and there's a lot of things going on. But everyone has 24 hours. What you choose to make a priority is what's really going to dictate how much time you do or do not have. Sure, you might have to wake up earlier, you might have to go to bed later, you might have to use your lunch in a more productive manner, but we all have time. It's what we're making our priority that makes it feel like we do or do not have that time. So we need to remove that limiting belief that we don't have time to learn anything else. We do, right? And so with that, I would encourage you to find resources online, to find mentors in person, to take courses, do what fits best for you, but utilize the 3 years to focus on really learning how to coach movement. In my opinion, some of the best in-person coaching movements is going to be personal training. Find a part-time personal training job. It helps you develop how to communicate with clients. It helps you develop how people respond. Right? So there's so many other things that come into it. I think that personal training is such a valuable experience that if you have the opportunity to do it, I would highly encourage it. Lastly, if you're struggling to find resources, mentors, or courses, check out the link below to my Clinical Coaching Foundations course. Yes, this is a shameless plug, but I genuinely believe that you will find it incredibly valuable. Why? Because over the past 12 years, I've owned 2 personal training studios and 1 cash-based clinic. This has allowed me to work with hundreds, if not thousands, of patients and clients to really help them get long-term success. And to me, the differentiating factor is how to coach movement. And that goes into how to communicate and how to comprehend it, assess it, and program it so it's intentional to them. So if you really want to start to accelerate your movement knowledge, feel free to check that out or leave a message below if you have any questions. But again, the big takeaway from this entire video is starting to put the time in now to enhance your movement coaching skills so that when you graduate, we don't have imposter syndrome, but we already own our movement expert title.